So I was influenced to become a dermatologist during my third year of medical school in an optional rotation in the department. I found that I really wanted to work with all ages of patients, from babies to the elderly, and dermatology provided that opportunity, as well as developing nice relationships with patients and their families over time. And it also provided me with surgical procedures that I could do in an outpatient setting, and so it fulfilled both the clinical and surgical needs that I was wanting to help fulfill my needs as a physician and dermatologist. The skin is the largest organ in the body, and then by that means can show us a lot about what's going on inside the body. And so when patients come in with a rash, we look at the whole person and can oftentimes find internal problems and issues that we can help. And so that's very rewarding to be able to look at the whole person. I find that dermatology is a very rewarding specialty. I'm able to make connections with patients and their families with things as simple as acne, changing how people feel about themselves and their self-worth in terms of how they view themselves when their skin changes and improves. So as small as acne to we're seeing huge advances in psoriasis care. It is also very rewarding in terms of treating skin cancers. We're seeing such an increase in melanoma skin cancers, and the earlier you detect these skin cancers, the much more likely you are to save a patient's life. There's a lot in the rural areas of patients that have worked outside their whole lives, that have farmed and have had a lot of sun exposure, are at high risk for skin cancer, and we can provide services to help them and try to detect early lesions and provide treatment before things become too extensive. I chose RAMC because they are first and foremost very supportive of their employees, all of their staff and physicians, and that just carries through to the patients and their approach to taking care of the patient. You have to take care of your employees and staff that take care of the patients first. And I really feel that that is a priority here at RAMC. I am married and have 3 children, and we live on a farm in a rural area, and I spend a lot of time with my children, a lot of time in the car, driving to and from practice and to sporting events, which I love doing. I will dearly miss that when it's over, but I spend a lot of time photographing them at their various events. So we have cross country and gymnastics, soccer, and wrestling. So I have learned to love photography. My children may not like that as much, but it's been a joy to watch them excel and grow.